Hello, my name is Matt, and today I will be doing my anatomy presentation on COPD. Alright, so etiology. So COPD stands for chronic obstructive pulmonary disease. It's a chronic inflammatory disease that obstructs airflow from the lungs. There are two main causes of this, emphysema and chronic bronchitis. And as you can see right here in this diagram, chronic bronchitis, it is inflammation and excessive mucus in the airways, especially in the bronchial tubes within the lungs. And emphysema, which is healthy alveoli are broken down and it causes poor exchanges of gases in the lungs, such as oxygen and CO2. All right, so demographics. So between the years 1998 and 2009, there was a very stable trend of COPD. And as you can see within this chart right here, they remain between about 4 and 8%. And then these trends also began to continue up until about 2022. Then they all remain the same, roughly. COPD, it does remain higher in women than it does in men. It is very prevalent in older people, especially those who do smoke, and it's more prevalent also in Puerto Rican and non-Hispanic white adults. All right, so anatomy. So within the lungs, you have the upper and the lower respiratory systems. The upper respiratory system includes the nose, the nasal and oral pharynx, epiglottis, and the larynx. The lower airway includes the trachea, the bronchus, bronchial tubes, and the alveoli. And then if we can see within this diagram here, you can see on the very top, that is a normal healthy lungs. You can see the bronchioles are clear of mucus and the alveolar sacs are quite large. And we come into the lungs with COPD, you can see bronchitis causes the bronchioles to lose their shape and change and be full of mucus. And within the walls of the alveoli, they're destroyed and they're causing fewer large alveoli to be present, meaning less oxygen and CO2 being exchanged within the lungs. All right, so physiology and symptoms. So unfortunately, symptoms, they don't usually appear until significant damage has occurred to one's lungs. Common signs and symptoms include shortness of breath, wheezing, chest tightness, chronic cough, lack of energy, and with those ones specifically, they'll very relate to the lungs being deprived of oxygen because there's a heavy blockage and damage to the alveoli. And then you can also see in some people weight loss and swelling of feet and ankles. All right, so diagnosis and treatment. So again, like the previous slide said, COPD, it's not really diagnosed until the disease is very advanced, unfortunately. Doctors will go over signs and symptoms and go over family and past medical history, most likely looking for things such as a history of smoking, history of COPD within the family, stuff like that. There are tests that they can do to help test and diagnose for COPD, such as chest and X-ray, lung function test, where they'll make you take breaths, how long you can hold it. I remember a long time ago when I did things such as allergy tests, I was told to blow a row of candles out and see how long I can hold it. So they'll do tests such as those. CT scans, and then also lab tests where they'll draw blood. And then treatment, so those with like mild forms of COPD, they might not need as much therapy or treatment. one common thing is to definitely reduce the amount of smoking you do, or if anything, quit it all. And then for the more advanced stages, definitely, as I said before, quit smoking. One of the best steps you can do. Medications, and then things such as bronchodilators and steroids to help clear up your lungs and have better breaths and then outcome for your lungs. And then these are my references, and then I thank you and hope you enjoyed it.